Hello guys, how are you all? Hi Mohammed, how are you? Rishiraj, Pushpalata, how are you all? So all of you were there for the last live previously when we were discussing the growth and development. I think most of you were there, right? So let us wait for 5-6 more minutes and then we shall start. Hi Jasmine, how are you? Hello Med Booster. Hi Vikas. Right, so I'm fine, Med Booster. Thank you so much. How are you? So previously we discussed regarding the growth and development, right? So we discussed all the calculations, how to do, right, with all the examples and all. So I think most of you loved that session, right? I'm fine. Thank you so much, Jasmine. And Making, hi. So today we shall be mainly discussing regarding perinatal asphyxia and hypoxic ischemic encephalopathy, right? The topic, the naming of the topic is lengthy. At the same time, the topic is also lengthy. There are many interesting things actually to discuss in this topic. So if you are all ready, right? If you are all ready with a pen and a paper, then we shall start discussing this topic, right? So hi Lokesh, how are you? I'm fine. Thank you so much, Lokesh. So, shall we start discussing, guys? Shall we start discussing? Yeah. You're all ready? Everyone is ready, right? Right. So, let us start discussing now. And by the way, all of you are from which year, guys? Which course are you studying? So you might be having pediatrics. Some of you are done with pediatrics, right? Some of you are already doctors over here, and I'm really happy for that. Right? Chalo, let's start now. Okay? First year. Many of you are from first year. Oh my God. Right. Even pediatrics is a subject of kids. Okay. So don't worry about that. Right. Very good, Lokesh. So this will be a very good subject for you to remember right now in the final year. Right. Chalo. Let's start now. Okay. So here, if you look here, right. So a baby is telling hello to you, right? So you have to diagnose what are the problems that are present in the baby over here, but she is happy. She or he, I can't figure it out anyways. But anyway, so all of you tell hello. Hi bolo ek bar, right? For the baby's satisfaction. Very good. Chalo. So what is this perinatal asphyxia? What is this perinatal asphyxia? What is this hypoxic ischemic encephalopathy? Before I discuss perinatal asphyxia, guys, one very important thing I want to discuss is hypoxic ischemic encephalopathy. ठीक है पहले ये डिस्कस करेंगे and then we shall discuss what is perinatal asphyxia. So what is, by the name itself, see, hypoxic ischemic encephalopathy. There is something called as hypoxia, there is something called as ischemia to the brain tissue, which will eventually lead to the damage to the brain. Okay, so this is what is meant from the name there. Okay, now from now, what we shall discuss is that, see, for example, this is your blood vessel. Okay, this is your blood. Let us discuss this complete lecture, right, with a full understanding and full conceptually, guys. Okay, this is a blood vessel, and let us say that this is your brain. Okay, this is your brain. You know, normally there is sufficient amount of blood that is supplied to the brain, right? Within that blood also you have got sufficient amount of oxygen. For example, if the oxygen levels are cut down, or if there is decreased, cut down, or if there is decreased level of oxygen supplying to the brain, this would lead to a condition called as HIE. What does HIE mean? HIE means hypoxic ischemic encephalopathy. Okay? Now, and I want all of you to be too active in the group, guys. Okay? जब भी मैं कुछ पूछूंगा, you have to answer it. चलो. Now let us see what are the causes of this hypoxic ischemic encephalopathy. Later on we'll discuss the causes or the etiologies very clearly. Okay, risk factors के साथ हम discuss करेंगे. So right now what I want you to know is that I just want you to know three important causes. Okay, the first important cause. What is that cause which is interrupting the blood supply to the brain, guys? Anyone? Or which is yes. Right. What is that one cause which is leading low blood supply to the brain? For example, okay, for example, I'm taking a scenario of cardiac arrest. Okay, let us say there is a patient with a cardiac arrest, right? Now, when there is a patient with a cardiac arrest, you know that the heart is not pumping. When the heart is not pumping, then how do you think that enough amount of blood is supplied to the brain? So in this condition also, the baby might end up having hypoxic ischemic encephalopathy, right? Not only cardiac arrest, okay? Second important thing, if you see, trauma. For example, there is some kind of trauma, right? While birth or anything, whatever it is, there is some kind of trauma. Now, when there is a trauma, do you think there will be sufficient amount of blood left over in the body? No. Obviously, there will be blood loss. So whenever there is blood loss, when there is no blood within the body left, right? When there is little amount of blood that is left in the body, how do you think that the blood will be sufficiently supplied to the brain? Again, in this scenario also, the baby is going to end up having hypoxic ischemic encephalopathy, right? And third most important cause is perinatal asphyxia. Perinatal asphyxia. So perinatal asphyxia is the most important cause. Okay. Now, if you look at this perinatal asphyxia, one very important thing I want to tell you is that what is asphyxia? What is perinatal? First of all, perinatal matlab around the time of the birth, you know, around the time of the birth, that you call it as perinatal. So during that time, if anything happens either to the mother or to the fetus or to the placenta, that is causing decreased blood supply to the fetus. Okay, so around the time of the birth, around the time of the delivery, if there are decreased oxygen levels or decreased amount of blood that is supplied to the fetus, that would end up having hypoxic ischemic encephalopathy, right? So that is what is called as perinatal asphyxia. Okay, now remember one thing, perinatal asphyxia simply means around the time of birth, low blood supply to the fetus. Now, when you are supplying low amount of blood to the fetus, not only the fetus brain, but also the remaining organs also will be damaged, right? So when the remaining organs are also damaging, can I tell perinatal asphyxia can lead to multi-organ damage? Yes, it can also lead to multi-organ damage. It can also lead to multi-organ damage. All of you are understanding, guys? Everyone is clear whatever I'm telling? Yeah. So it is going to lead to multi-organ damage. Now, obviously, perinatal asphyxia will also lead to HIE, that is hypoxic ischemic encephalopathy also. Okay. So that is the reason why if someone is asking you what is the most common cause of hypoxic ischemic encephalopathy, that is perinatal asphyxia. Okay. Clear all of you? Very good. Very good, very good, very good. Right. Now, hypoxic ischemic encephalopathy, HIE, right? So, can I tell like this, that hypoxic ischemic encephalopathy will cause damage to the brain of the neonate? Yes or no? So, if it will cause damage to the brain of the neonate, that condition you call it as neonatal encephalopathy. Neonatal encephalopathy. Okay, that condition you call it as neonatal encephalopathy. So if someone asks you what is the most common cause of neonatal encephalopathy, that is hypoxic ischemic encephalopathy is the most common cause of neonatal encephalopathy. Okay, so most common cause of neonatal encephalopathy is hypoxic ischemic encephalopathy. Okay, so these are some of the important general points which you have to know, guys. Okay, now when I tell neonatal encephalopathy, so overall, right, let us go into details. Okay, details पे जाएंगे, but उससे पहले one important thing you need to know that neonate encephalopathy, damage to the brain, right? So this is what is happening whenever there is a brain damage or whenever there is a damage to certain part of the brain, right? Do you think the neurons which are running down, जो neurons नीचे आ रहे हैं ना, these are called as descending tracks. So do you think these motor neurons which are running down, right? Do you think they will be all right, or they will be also damaged? Obviously they will also damaged. So when they will be also damaged, do you think the neonate will have a normal tone or reduced tone? They will have a reduced tone. Okay, so what I'm trying to tell you is that because of neonatal encephalopathy, the muscle tone is reduced. Okay, not only muscle tone, even the reflexes are also gone. So there will be reduced reflexes. Reduced reflexes, and finally any problem that happens to the brain speaks only one language, that is called as seizure language. So definitely the child will have seizures. Okay, so all of you understood till here? All of you, very good, Jasmine, very good, Shraddha, very good, Vaisosik, very good. Hello, all of you understood till here? Before I go to the etiologies? Yeah, guys, everyone is clear till here, right? Be fast. Yeah. So now the next important thing we shall be discussing is etiologies. Etiologies. So what are the different kinds of etiologies we have? Now remember one very important thing. There are two important etiologies. Okay, instead of writing etiologies, let us write it as risk factors only. Okay, let us write it as risk factors. Write it as risk factors. ठीक है, ये देखो, there are two important risk factors, rather three, but two are most important. एक होगा एंटीपार्टम रिस्क फैक्टर्स, एक होगा इंट्रापार्टम रिस्क फैक्टर्स. ठीक है, अभी ये एंटीपार्टम इंट्रापार्टम क्या है? व्हाट इज एंटीपार्टम? एंटीपार्टम इज बिफोर बर्थ और आफ्टर बर्थ. यस, कैन एनीवन टेल एंटीपार्टम दैट इज बिफोर बर्थ और आफ्टर बर्थ? जल्दी. So what I was telling you there are two important risk factors है ना. एक होगा एंटीपार्टम रिस्क फैक्टर्स, एंटीपार्टम रिस्क फैक्टर्स, और सेकेंड चीज जो है दैट इज कॉल्ड एज इंट्रापार्टम रिस्क फैक्टर्स. सेकेंड इज इंट्रापार्टम रिस्क फैक्टर्स. वेरी गुड ऋषभ, वेरी गुड, very good, fun mode. Antepartum in the sense before the birth. See, exactly from the day of conception. Okay, today the conception has happened. From the day of conception till the onset of labor. Onset of labor matlab the labor contractions है ना. From conception till the labor contractions, that entire period is called as antepartum. देखो, conception से labor contraction मतलब almost it is around 40-42 weeks. Yes or no? From the day, let us say now a pregnant woman, the labor contractions have started. From now till the 4 hours, the first 4 hours after the delivery. Delivery of what? Delivery of the baby along with the placenta. Okay? So the first 4 hours after the delivery of the baby as well as the placenta, from the onset of labor contractions, ये जो period है ना, this is called as postpartum. Now you tell me, by my explanation here, antepartum is a lengthy period or postpartum is a lengthy period? I mean, intrapartum is a lengthy period. Obviously, antepartum is a lengthy period. Okay, so intrapartum is a small period. Okay, or I can also call it as intrapartum as a birthing process है ना. Birth का जो process होता है ना, that is called as intrapartum. Avikant, hello Avikant. So what I was telling you about antepartum is that antepartum matlab all the way from conception till onset of labor. Till onset of labor is called as antepartum. ठीक है, अभी onset of labor से लेकर the first 4 hours after delivery, The first 4 hours after delivery, this is called as intrapartum. Okay. Thank you so much, Avikan. Thank you so much for all the time encouraging me time to time. Right. So antepartum is almost around 40 weeks. You know? Antepartum is almost around 40 weeks and intrapartum is just few hours. है कि नहीं? Now tell me, which will play a major role in causing hypoxic ischemic encephalopathy or neonatal encephalopathy? Antepartum will cause. Because in this 40 weeks of time, anything can happen which can lead to reduced blood supply to the fetus. Yes or no? So what is that anything which will happen now? We shall discuss one by one. Okay? So first important factor here in antepartum. In antepartum risk factor, the first important thing you should know, but before that एक mnemonic दे दूंगा. Remember that PC SAM. Okay? PC SAM. That is a mnemonic. चलो. The first important thing is P stands for placental anomalies. Placental anomalies. Abhi, what is this placental anomalies, guys? Placental anomalies matlab kya? You know that there is a placenta, right, which is supplying nutrients and the blood time to time to the baby, right? So if there is any problem with the placenta, you call it as placental anomalies. Kya problem ho sakta hai? What can be the problem? The most important problem which you will see is fetal vascular malperfusion. Fetal vascular malperfusion. Fetal vascular malperfusion. What do I mean by fetal vascular malperfusion? Just all of you pay attention to whatever I'm drawing here. Okay? So all of you look now. Let us say this is the uterine wall. Okay? Yeah, uterine wall. Let us also tell that this is the developing fetus. This is the developing fetus. Okay? Now, all of you look here. This part, whatever I'm drawing with the blue, this is your placenta and ये जो है ना ये umbilical cord है. ठीक है? All of you know umbilical cord के अंदर क्या होगा? Umbilical arteries, umbilical veins. So just roughly I'm drawing umbilical artery like this. ठीक है? ये umbilical artery. Right. Now, umbilical arteries, umbilical veins, whatever are there, these are also called as placental vessels. है कि नहीं? Placental blood vascular system. Now, within this placental vessels, if there is any kind of thrombus that is formed, thrombus matlab sab jante ho, there is some kind of clot, let us say. ठीक है? Within this, if there is some kind of thrombus that is formed over here, do you think from the placenta sufficient amount of blood and nutrients will be supplied to the fetus? No. So when sufficient amount of oxygen is not supplying to the fetus, obviously the fetus later on will end up having, after the birth, neonatal encephalopathy or hypoxic ischemic encephalopathy. So all of you understood, this is what is called as fetal vascular malperfusion. The other name that is given for fetal vascular malperfusion is fetal thrombotic vasculopathy. ठीक है? Other name क्या है? Fetal thrombotic vasculopathy. So by the name itself, you can know what is vasculopathy, what is thrombotic here. Clear? So one anomaly which I am telling you is placental anomalies. Very good, Jasmine. Jasmine is also telling accreta, percreta. Very good. So even those anomalies also will lead to the problem. But those anomalies, Jasmine, they will very easily lead to abortion. Okay, so here we are specifically talking about what are the conditions that are leading to hypoxic ischemic encephalopathy, but still you are right. Very good. So hello Sajda, how are you? Right. So एक हो गया placental anomalies. अभी दूसरा, what is the second important thing? Second important thing is congenital infections. ठीक है? Congenital infections. So any kind of congenital infections can lead to a reduced blood supply to the fetus. है कि नहीं? Congenital infections के बाद P and C are done. ये देखो PC is done. Next SAM. S stands for substance abuse. Substance abuse. ठीक है? Substance abuse क्या है? For example, if there is an intake of alcohol, or if there is an intake of cocaine or amphetamines, cocaine, amphetamines. अब ये देखो sir, how can a neonate take all the, not neonate beta. So whenever a pregnant woman, right, a pregnant woman, if you see in the European countries and all, where there is a lot of snow, right, so there they have a habit of smoking. Even they are pregnant, they have a habit of smoking. But if she will have some extracurricular activities, for example, cocaine and taking amphetamines and all, then the fetus inside, there will be less blood perfusion to the fetus. Okay, so this would lead to even fetal death also. So she is, hello Chinyani, hello, right. So she is almost killing her own baby, right? So all of you understood what is substance abuse is, है ना? Now the fourth important thing we shall discuss is that abnormal maternal oxygenation. Abnormal maternal oxygenation. अभी ये abnormal maternal oxygenation क्या होगा? Some of you, very good, Sajda. I think the climate in Qatar is very, very hot. I think once I've been there, it was very, very terribly hot. So abnormal maternal oxygenation. Abnormal maternal oxygenation मतलब क्या? For example, let us say a woman is pregnant, right? Now she is driving the car so fastly, she ended up having an accident. So there is a lot of blood oozing out. So she is basically in trauma. So there is a lot of blood loss, right? Now do you think sufficient amount of blood will be supplied to the fetus? Obviously she is not having her own blood volume. How can she supply to the fetus? No. Second important thing is, for example, she is a hypotensive patient, right? Or there is sudden hypotension which usually happens in pregnancy. Okay? So in that case also she can't supply enough amount of blood to the fetus. Or तीसरा, in pregnancy anemia is most common. Even in a case of anemia also she can't supply enough amount of blood to the fetus. Obviously when there is no blood, obviously it leads to anemia only, right? So what are the abnormal maternal oxygenation features? Abnormal maternal oxygenation features matlab either there can be trauma, okay, or there can be hypotension, or there can be severe anemia. So all these cases, the fetus is not receiving sufficient amount of blood. All of you, yeah, Jasmine, maternal anemia is what we are discussing now. Yes, Chinyani, I am right now I'm discussing neonatal asphyxia only. This is the topic which you are in. ये देखो यही है topic अभी. We were discussing perinatal asphyxia, hypoxic ischemic encephalopathy. Okay, चलो. So next important thing, SAM, right? SAM. S is done, A is done, and now we have to discuss about M. What is M? M stands for maternal conditions. M stands for maternal conditions. Can anyone name few maternal conditions, guys, which would lead to reduced or decreased blood supply to the fetus? Anyone? Few maternal conditions. Come on, be fast. Few maternal conditions क्या हो सकता है? Cardiovascular problem, fun mode we discussed already, cardiovascular problem, but still you are right. Diabetes, very good, very good. Fun mode is telling diabetes, very good. So the first most important problem is diabetes mellitus. Okay, the first most important problem is diabetes mellitus. Now, very good, Jasmine, low nutrition, poor diet, and Chinia is telling hypertension, very good. So first of all, we'll discuss one by one, okay? All the things which you have mentioned there, we'll discuss one by one. Now, important thing is, dekho, if mother is diabetic, her blood glucose levels will be high. Then why there is decreased perfusion of blood to the fetus? What is the relation between that? What is the relation between mother being diabetic and decreased blood perfusion to the fetus? The only relation is that there are two important points which you have to know. For example, let us say, yeah, so this was a fetus, right? This was a fetus, right? Now, this is your umbilical cord. Okay, now instead of drawing umbilical cord, directly I'll draw the blood vessel. Okay, now all of you know that whenever there is increased level of glucose in the mother, right, obviously through the blood the glucose levels will enter into the fetus, and even in the fetus also there will be increased blood glucose levels. Yes or no? Now as the glucose from the mother through the placental veins, through the placental vessels, as the glucose is entering like this, what will happen is that high glucose level will cause edema of your blood vessels. Okay, they swell your blood vessels. So whenever there is thickening of the walls of blood vessels because of high glucose, okay, so high glucose will cause thickening of the walls of the blood vessels. Now because of this, when the blood vessel wall is swollen, it is becoming thick, do you think sufficient amount of blood will enter into the neonate, into the fetus? No. So again here also at the end of the day, what is it resulting in? Decreased oxygen into the baby. Okay, so what is the main cause? The main cause is thickening of walls of the blood vessels. Thickening of the walls of the blood vessels. Okay. Second important cause. For example, if there is high level of glucose, okay, this is A for one cause, and now look at the second cause. What can be the second cause? Second cause is that, for example, let us say this is the uterine wall. Okay, so यहाँ पे है fetus, and this is the umbilical cord. Okay, this is an umbilical cord, and let us also tell that this is your blood vessel. All of you know, lining your blood vessel, what are the cells you have got, guys? Tell me. You have got endothelial cells like this. Lining your blood vessel, you have got endothelial cells. Now remember one thing, whenever the glucose levels are high, this high glucose levels will damage the endothelium. Okay? Ye dekho. These high glucose levels, what they do is that they damage this endothelium. When the endothelial cells are damaged, what is the second thing that is going to happen, guys? All of you know that platelets are going to come and aggregate over here, right? And these platelets will call some more platelets. So this is called as platelet aggregation. Platelet aggregation होने के बाद क्या होगा? There are a lot of fibers that are deposited, and finally it will result in the formation of a clot, right? Or a thrombus. Now when there is a thrombus, you know the story. Obviously the blood vessel will be obstructed. So how do you think the blood from the placenta can reach to the fetus? It cannot reach, है ना? So the second important cause is blood clot. Second important cause is blood clot. So all of you understood these two reasons in why in diabetic patients, right, the fetus receives the blood, less blood, decreased blood supply. I hope all of you understood, right? So after diabetes, fun mode already told hypertension. So let us discuss what is this. Hypertension in pregnancy, you call it as preeclampsia. Preeclampsia. Exactly speaking, preeclampsia is also called as pregnancy induced hypertension. है ना? Preeclampsia is also called as pregnancy induced hypertension. Pregnancy induced hypertension. So usually when does this hi Vanilla, tell me guys, when does this preeclampsia basically happen in the gestational age? Batao. At which time does this preeclampsia usually happen? Any idea? Which week of gestation does this preeclampsia happen, guys? Actually, preeclampsia starts after 20 weeks of gestation. After 20 weeks of gestation, the preeclampsia starts. Okay, so preeclampsia starts after 20 weeks of gestation. So what is basically preeclampsia, guys? Preeclampsia matlab, for example, if the blood pressure is more than 140/90 on two separate occasions, more than 140/90 on two separate occasions. Two separate occasions matlab when you check two times. Occasion matlab not a function, okay? So two separate occasions, or more than 160/110 plus proteinuria. So this is what is called as preeclampsia. So even in high blood pressure also, what can happen? what can happen, guys? Obviously, the endothelial blood vessels, endothelial layer, endothelium, whatever is there in the blood vessels. So, because of high pressure, these cells can be damaged. When the cells can be damaged, again the same story, thrombus will be formed. Okay, so all of you understood, guys? All of you understood this? Now, after this, one is diabetes mellitus we talked about. Second one is preeclampsia, right? Now coming to the third most important thing, and that is called as congestive heart failure. Congestive heart failure. Okay, so all of you know this thing, that in case of congestive heart failure, what is going to happen? The ventricles are not pumping the blood properly. They cannot pump the blood because the heart is failed. So when they cannot pump the blood, obviously the cardiac output also will be less. So less amount of blood will be supplied to the fetus, and this would lead to hypoxic ischemic encephalopathy. So even congestive heart failure. So till now, whatever I have discussed, guys, all these are the symptoms. What are the symptoms? Antepartum risk factors है ये. क्या बोलता है इसको? Antepartum risk factors. So we have discussed placental anomalies. दूसरा congenital infections. तीसरा substance abuse, abnormal maternal oxygenation, and finally the maternal conditions. So now, before I go to intrapartum risk factors, I just want a green signal from you that all of you understood till here whatever I've told you. Yes or no? And for all of those who will be watching this video later on, so even you guys also comment down that whether you are understanding all the things which I'm telling you or not. Okay. Very good, Vikram Babu. Very good. Thank you so much. Yeah, this is a nice topic and a difficult one and a tricky one also. Chalo. Now the second important risk factor is क्या बोला था? Intrapartum, which is a short period of time, or I can also call it as a birthing process, है ना? So let us discuss now. Medicine recap. Hi. Intrapartum risk factors, है ना? What are the intrapartum risk factors? So intrapartum risk factors मतलब guys, delivery करते time, है ना? My Hindi is bad. While doing the delivery, during the process of delivery, if there is any kind of trouble that the baby is facing, है ना? Any kind of trouble that the baby is facing, this can lead to asphyxia. Right? This can lead to hypoxic ischemic encephalopathy. So what are those things? What are those things? Matlab, generally speaking, guys, during the birthing process, what can happen? There can be trauma. है ना? You put the forceps and pull the baby out. You put the suction tube and pull the baby out. है ना? Or you pull the baby out with your own hand. Sometimes there might be problem with the shoulder. So all these things come under trauma. So the first most important thing will be traumatic delivery. Traumatic delivery. Traumatic delivery. Yes. Chinmay is telling that prolonged labor. You are right. Right. You are perfectly right. I'll tell you what is that prolonged labor here now. Traumatic delivery. Traumatic delivery मतलब one example of traumatic delivery देता हूं, that is called as shoulder dystocia. Shoulder dystocia. What do you mean by shoulder dystocia? Shoulder dystocia matlab when you're catching hold of the head and when you're pulling the baby out, what can happen is that the shoulders, whatever are there, they get stuck behind the pubic bone. Either right shoulder or left shoulder or sometimes both the shoulders, they get stuck behind the pubic bone. So when they get stuck behind the pubic bone, what will happen is that this is the pubic bone, this is the shoulder, ये दोनों के बीच में umbilical cord, right? The umbilical cord is pressed against the pubic bone and this would lead to umbilical cord compression. अगर umbilical cord compress हुआ, do you think sufficient amount of blood is transferring to the baby during the time of delivery? No. So this short period of time, if there is no oxygen to the baby also, that can lead to hypoxic ischemic encephalopathy. I'll show you a picture for you. ये देखो. Exactly, look at this picture here. Okay? Look at this. So this is your pubic bone. Okay, this is your pubic bone and this is the shoulder of the baby. Now, can everyone clearly see an arrow which I'm pointing here? The umbilical cord is getting compressed against the pubic bone. Agar umbilical cord compression hua, the umbilical cord have not cut yet, right? So obviously there will be decreased blood supply to the fetus. I mean the delivering baby, the neonate, yes or no? So obviously this would again lead to hypoxic ischemic encephalopathy. Am I clear, guys? Yeah, very good. Shinya is telling birth injury. It is a type of birth injury. Yes or no? Everyone understood this thing? Very good. So what I'm trying to tell you is that in case of shoulder dystocia also, there is umbilical cord compression. Umbilical cord compression. Okay? Shoulder dystocia also umbilical cord compression. Not only shoulder dystocia, there is another thing called as vacuum assisted delivery. है ना? You put a vacuum tube on the baby, like a suction tube it will be, and you start pulling the baby. Now sometimes the vacuum might not be enough to catch hold of the baby, right? So what will happen because of that? You put a suction like this, right? And again the vacuum tube will automatically release by itself, and again you develop a suction and put it onto the head, and again it can detach from the head. So due to this, what is happening is that the labor period, whatever is happening, there is a prolongation of that. So there is a prolonged labor. So during this prolonged labor, anything can happen to the umbilical cord. Okay. So the second important thing is a failed vacuum assisted delivery. Failed vacuum assisted delivery. Clear, all of you? Failed vacuum assisted delivery. So both of these examples, they come under traumatic delivery. Okay. Chalo, ठीक है. Traumatic delivery, leave it now. What about cesarean section? C-section. Cesarean delivery with or under general anesthesia. Can anyone tell why cesarean section delivery under general anesthesia will lead to reduced blood supply to the fetus? Anyone, guys? Anyone can tell this? I can still call it as a fetus only. You know, from 8 weeks onwards till the birth, you call it as fetus, right? So why cesarean delivery with general anesthesia? Why does cesarean delivery lead to hypotension in the fetus? I mean, less blood supply to the fetus. Batao? Very simple logic, very simple explanation. Fun mode is telling anesthesia. Okay, what will anesthesia do? Fun mode. What does this general anesthesia do? What does this general anesthesia do is that anesthesia causes hypotension. Anesthesia leads to hypotension, right? Anesthesia leads to hypotension. So hypotension matlab low blood pressure. So obviously when there is low blood pressure, there is reduced amount of blood that is supplied to the fetus. So reduced blood supply to the fetus, and obviously when reduced blood supply to the fetus, what is the end result? Hypoxic ischemic encephalopathy. Okay? Now, after this, the third important cause is impaired placental perfusion. Impaired placental perfusion. Now, I don't want to explain about this impaired placental perfusion, guys, because you know, if there is any problem with the placenta, with the attachment of the placenta, है ना, obviously there will be decreased perfusion. You know that, very simple. Next, abnormal maternal oxygenation. फिर से आया ये point. Abnormal maternal oxygenation. If mother is not sufficiently providing blood or oxygen to the baby, so that will also end up having HIE. So maternal oxygenation. Okay, this is also one intrapartum risk factor. Fifth important thing is umbilical cord prolapse. Umbilical cord prolapse. ये बहुत important है. Umbilical cord prolapse, है ना? तो ये क्या होता है? What is umbilical cord prolapse? Already, someone just now told me about umbilical cord prolapse, है ना? I think Chinie told me about umbilical cord prolapse. Yeah, Chinie told premature rupture of membrane. Very good. So all of you look here, umbilical cord prolapse. So if you look at this picture over here, you can understand it very well. So you can see here that this baby is giving cephalic presentation. So under this cephalic presentation, you can see the membranes have been ruptured here. ये देखो, membranes have been ruptured and umbilical cord prolapsed into the vagina. है ना? So when umbilical cord is prolapsing into the vagina, whatever it is, the child head, whatever is there, the fetal head, whatever is there, it is compressing the umbilical cord. So when it undergoes compression of umbilical cord, obviously you know what will happen? HIE. है ना? So this is what is called as umbilical cord prolapse. Cord prolapse. So prolapse कहाँ पे? Prolapse into vagina. Prolapse into vagina. Okay? Umbilical cord prolapse into vagina. So all of you understood this, guys? है ना? So कहाँ तक discuss किए? 5 reasons है ना? Now I am discussing the 6th one. Now let me discuss the 6th important thing. 6th important thing ये होगा कि there can be some conditions where the umbilical cord can wrap around the neck. ये तो direct asphyxia हो गया, है ना? अगर umbilical cord is directly wrapping around the neck, obviously, do you think sufficient amount of oxygen can enter? No. So the neonate will lead to asphyxia, right? So all of you look at this picture. You see umbilical cord is tied around the neck. We don't tie it. It ties around itself. है ना? So umbilical cord is tied by itself. So this is also called as cord wrapping. है ना? What is this called? Cord wrapping. Or it is also called as nuchal cord. What do you mean by nuchal cord? It means the cord wrapped around the neck. Around the neck. So because of this क्या होगा? Because of this there will be compression. Because of this there can be compression. All of you understood? Yeah. The last important cause is there might not be compression, there might not be wrapping around the neck, right? But it can happen like this, that sometimes the umbilical cord can knot by itself. So there can be knot that was formed within the umbilical cord. All of you look at this. ये देखो, यहाँ पे knot formation हुआ ना? There is a knot that is formed here. You see, there is a knot that is formed here. Now, because of this also, there is no sufficient amount of blood that is supplied, right? So, 7th important point is umbilical cord knot. Umbilical cord knot. So, these are all the important reasons which you need to know for this hypoxic ischemic encephalopathy. Okay? So what I am trying to do is that, so these are all the reasons we discussed about impaired placental perfusion, we discussed about abnormal maternal oxygenation, we discussed about maternal hemodynamic compromise, traumatic delivery, C-section with anesthesia, umbilical cord prolapse, nuchal cord and knot. How do you remember? All these are intrapartum risk factors only. But how do you remember them? How do you remember it? Just remember like this, that when you do naughty things in the school, obviously the school principal will give a transfer certificate, TC. So I am giving TC to you. I am giving TC to you. So you can name here accordingly. I am giving TC to you. Clear? So all these are intrapartum features. All these are intrapartum risk factors. So we discussed broadly into 2 risk factors. एक हो गया antepartum, एक हो गया intrapartum. Antepartum also I have given you a mnemonic there, PC-SAM. Okay, so there you can figure out all of the things, and for each and everything I have given you an explanation. Intrapartum, maybe for each and everything I have given you an explanation, and the mnemonic is I am TC, I am giving TC to you. Okay, so all these are the intrapartum risk factors. So till here, guys, all of you understood. Sajda has given a new mnemonic. She's telling I am cut. Very good. CUT. Yeah, I am cute. Fine. Yeah, so even that also works. Very good. I never exaggerated that much about myself. So that's why I've written in I am TCU. Right. Chalo, jo bhi hai, whatever mnemonic suits you, you can use that. So these are the two important factors, guys. Now, next important thing after antepartum intrapartum के बाद अभी तीसरा और most important है, that is nothing but called as fetal factors. That is nothing but called as fetal factors. What are the fetal factors that are leading to less oxygenation supply? Two things. I see fetus is having heart. Fetus is also having lungs. Okay. What can happen to the heart? Anyone? What can happen to the heart is, for example, if there is congenital heart defect. Agar congenital heart defect है, do you think the heart will be working properly or there is a heart failure? There is a heart failure. When there is a heart failure, do you think ventricles are contracting or decreased myocardial contractility is there? Decreased myocardial contractility. जब ventricles blood pump नहीं कर रहे, then obviously the amount of blood reaching to your brain also will be low. Same thing, hypoxic ischemic encephalopathy. So regarding the heart, the very important thing is congenital heart defects. Congenital heart defects. When it comes to the lungs, this is the most important thing, guys. Very, very, very important thing. What is an important thing is that, for example, you know, babies are normally delivered during 38 to 42 weeks. है ना? Is 38 to 42 weeks of gestation के बीच में, during that time the baby will be delivered. So before 37 weeks, if there is a delivery that is happening, or before 36 weeks, है ना? This is called as preterm delivery or premature delivery. Why are you calling it as premature? Because the baby's lungs are not properly developed. The baby's lungs will be developed by at least 35-36 weeks of gestation. So if the delivery is happening before 36 weeks, before 35 weeks, the lungs are not properly developed. So obviously when the baby is delivered out, when there is a neonate outside, so he cannot breathe properly because his lungs are not fully formed. Okay. So that can lead to hypoxia. Yes or no? So let us see in detail what are these conditions here. Okay. First of all, let me put up the heading. Premature infant, ठीक है, or preterm infant. Preterm infant मतलब less than 37 weeks. This is called as a preterm infant. Very good, Jasmine. There is a distress in baby. That is what I'm going to discuss now. Very good. So she's telling there is a distress. Obviously, that is called as respiratory distress. ये देखो. This is the alveoli. This is the alveoli. All of you know that alveoli is lined by some cells. These are called as alveocytes. I'm not drawing them fully, just few I'll draw. These are called as alveocytes. These are called as alveocytes. Now, out of all these alveocytes, there are few important alveocytes. These are called as type 2 alveocytes. What are these called? Type 2 alveocytes. Now, these type 2 alveocytes are the one which release surfactant. All of you know what is surfactant, hai? These type 2 alveocytes are the one which will release surfactant. Dekho guys, simple rule from today onwards, what you have to remember is that, see, within the lungs we need surfactant. Agar surfactant nahi hai, to kya hoga? Surface tension jo hai, that will increase. When the surface tension within the lungs will increase, the alveoli which is open now, because of increased surface tension, the alveoli will collapse like this. Once the alveoli is collapsed, this is what is called as atelectasis. Okay? So all the alveoli will collapse. The lung also has got collapse. Lung collapse is called as atelectasis. So to keep the lungs open, to keep the alveoli open, we have to reduce the surface tension. So यहाँ पे कौन reduce कर रहा है surface tension को? Surfactant is reducing it, right? And when is surfactant synthesized? Surfactant is synthesized at 20 weeks of gestation. At 20 weeks of gestation, type 2 alveocytes start releasing surfactant. है ना? अभी surfactant release होगा तो that is not enough. We should even spread the surfactant all along the surface of the alveoli. So the complete spreading of surfactant all along the alveoli will happen by 35 weeks of gestation. है ना? So from 20 weeks till 35 weeks, this is a phase where the lungs are completely immature. Completely underdeveloped. अगर इस टाइम डिलीवरी हुआ, Do you think the baby will survive properly? Can he oxygenate properly? No. It would lead to again hypoxic ischemic encephalopathy. All of you understood? Yes? So, what will happen is that if surfactant is not there, this is how the alveoli will go. ये देखो ये normal alveoli है. Now, if the surfactant is not there, the alveoli are collapsed. Okay. Now, all of you know, through this normal alveoli, there is oxygen and carbon dioxide diffusion. You did not understand, Jasmine? What I'm telling is, from oxygen will diffuse here, at the same time carbon dioxide will diffuse out. अगर alveoli collapse हुआ, right? Do you think oxygen carbon dioxide diffusion happens? No. So do you think oxygen, sufficient amount of oxygen is right now within the pulmonary capillary? No. There is decreased level of oxygen. अगर lungs के अंदर कम oxygen आए, then the amount of oxygen reaching to the brain also will be less. So again, this is ending up in hypoxic ischemic encephalopathy. And अभी तक जो मैंने concept explain किया, till now whatever concept I have explained you, this is called as respiratory distress syndrome. Respiratory distress syndrome. Okay, this is what is called as respiratory distress syndrome. All of you understood whatever I have told you guys? Yeah, everyone. Sajda, you understood? All is well. Muhammad Asif and the remaining who are not at all commenting, sub understood? Muhammad Ali understood? Chinenye, I'm sorry. Chinenye, you understood medicine recap. Shraddha, Vanilla, Vikram. Yes, you are right. I'm sorry. You're right. Very good. Very, very, very good. Okay? Right. So one important problem in the lungs which we discussed is premature infant or preterm infant. ठीक है? अभी दूसरा problem क्या है? What can be the second problem? Second important problem can be what all of you know, that is aspiration. है ना? We call it as aspiration pneumonia. है ना? Aspiration. Now a fetus, right? What can a fetus aspirate, guys? बताओ. क्या aspirate कर सकता है? What can it aspirate? It can aspirate two things. Either it is aspirating amniotic fluid, right? Either it is aspirating amniotic fluid or it is aspirating meconium. All of you know what is meconium, right? Sir, what will happen when amniotic fluid and meconium are aspirated? What will happen is that, ये देखो, this is your alveoli. Let us say the meconium has been aspirated. So meconium, for example, meconium, don't you think it will obstruct the alveoli? अगर alveoli का obstruct किया, do you think sufficient amount of oxygen is going to enter into the alveoli? No. Again, it would lead to hypoxia only, right? So all of you understood these causes, guys? Everyone, because now I'm going to explain you what is the pathophysiology of multi-organ damage. Because whenever there is hypoxia to the baby, two things will be damaged. One are the organs, the remaining including brain also, but we shall differentiate into two. Brain, pathophysiology of brain damage we shall discuss separately. Pathophysiology of multi-organs damage also we'll discuss separately. Okay? So we'll discuss two pathophysiology concepts now. Very, very, very important, right? So till here everyone is clear, then only I'll start if you are clear. Batao, everyone is clear, right? Jasmine is clear, Sajda is clear. Sajda and remaining all of you. What happened to Vanilla? Fun mode, where are you? Chinenye, you're not at all here. You vanished. Or you're silently watching my classes? Very good. Right. So, Let us discuss the pathophysiology of multi-organ damage. Now, don't write any notes, right? If you're not at all writing the notes, then fine, happy. But don't write any notes now. Just listen to whatever I'm telling, okay? Pay full attention to whatever I'm telling. Don't even get distracted anywhere, because this is a very important concept. Now, regarding the pathophysiology of multi-organ damage, right? Now, all of you look at this picture. Now, in this picture, what I have done, all of you know, on the right hand side, you have got liver, you have got kidney, you have got skeletal muscle. Abhi center mein, in the center, you have got brain, you have got heart, you have got adrenal gland. Okay? Now, what I am telling you is that liver, kidney, and ye skeletal muscle, jo hai, these are the peripheral organs, right? These are the peripheral part, peripheral tissues. ये brain और heart जो है, these are the central and the most important part. Okay, brain and heart is the central as well as the most important part. Clear? Now look, for example, whenever there is decrease, don't comment now, just look. Whenever there is decreased amount of blood supplied to the tissues, decreased oxygen supplied to the low oxygen supplied to the tissues, this condition, all of you know, it is called as hypoxia. Whenever there is hypoxia, what will happen is that automatically in our body, there is sympathetic system that is getting activated. Okay, this happens in you and me. Now, when sympathetic system gets activated, you tell me, in sympathetic system, where there will be vasoconstriction or vasodilation of blood vessels. There will be vasoconstriction. So what is going to happen in my body is that right now, there will be vasoconstriction of my peripheral arteries. Peripheral arteries matlab arteries which are supplying the blood to the liver, kidney and skeletal muscles. So whenever there is vasoconstriction of peripheral arteries, why are you doing this? Because I don't want to supply, in this condition, I don't want to supply blood to these peripheral organs. What I want to do is that by vasoconstriction, I will bypass all the blood, I would divert all the blood from the peripheral organs to the central organs like brain and heart. Because brain and heart in this condition, hypoxic state, it's very important to me. So that is the reason why I have vasoconstricted all of them. Now, because of this vasoconstriction, don't you think the peripheral tissues, whatever are there, they die of ischemia? There will be organ damage, liver will be damaged, skeletal muscle will be damaged, the kidneys will be damaged, right? So, can I tell multi-organ damage has already started? Now, this concept, whatever I've told you, just put it aside. Okay? Now, look at the second thing. For example, there is a city. City ke andar there is a water machine, there is a grocery store also. Now, daily you go, get up, buy water, and take the water, buy the things from the grocery store. Okay? Now, let us say the next day itself, there is a war in the city. The war has started. Now, when the war has started also, daily you'll go in the morning by walk, take the food and all and come. No. At a time, you will take lots and lots of groceries and you will take a bulk amount of water and store it in your house. The first thing what you do, you drink water or you eat the groceries? The first thing you'll finish off is groceries, right? Once the groceries are done, now you'll start drinking the water. Now, even still the hypoxia is continuing, even still the war is continuing, then what will happen? One or the other day, the water also is finished and you will die. Now, the same concept, apply it here. Okay. What is the same concept which you are applying it here is that, for example, because of this hypoxia, what I did is that I have diverted the blood that is coming from the peripheral organs to the central organs, right? If this hypoxia is still continuing, the blood which is supplied to the central organs, within this blood, the oxygen levels slowly, gradually they will drop down. So can I tell that in prolonged hypoxia, even brain and heart are also deficit with oxygen? So in prolonged hypoxia, when your heart is not receiving enough amount of blood, can your heart pump? No. Your myocardial compromise will happen. Myocardial ischemia will happen. So when your heart is not pumping enough amount of blood, do you think enough amount of blood is supplied to the peripheral organs? No. Already because of that vasoconstriction initially which you did, you are causing multi-organ failure, right? Adding upon that, now heart is also not functioning. There is not even a little amount of blood going to the organs. So the multi-organ damage will worsen or will it recover? Tell me, multi-organ damage will become more, or will this condition worsen, or will this condition get better? Batao? Did you understood first of all whatever I told you? All of you understood, right? Or it went like a express, super fast express? Very good. I'm happy you're answering. Very good. It will worsen. Okay, it will worsen. So in this is the pathophysiology of multi-organ damage which is happening here. Now let us look at the points which I have already written here. है ना? Now what are the points which I have told you? First, hypoxia will lead to decreased blood perfusion to the tissues. Okay? Because of that, what is happening? There is a backup mechanism in my body. Backup mechanism क्या होगा? Sympathetic activity is increased. When there is sympathetic activity that is increased, what did I tell you? Peripheral arteries are vasoconstricted. Because of this, the blood is diverted to the central organs. This phenomena is called as circulatory centralization. है ना? वहां से तुम ब्लड यहां पे डाइवर्ट कर रहे हो टू द सेंट्रल ऑर्गन्स. दिस इज कॉल्ड सर्क्युलेटरी सेंट्रलाइजेशन. ऑल ऑफ यू कैन लुक इन द पिक्चर. ये देखो, देयर इज vasoconstriction here. See, there is a vasoconstriction. There is a vasoconstriction. Now because of this, what is happening? The blood which has to come, it is taking a diversion. You see, the blood which has to come, it is taking a diversion and supplying to the central organs like this. Clear? So because of that, what is happening? Decreased blood supply to peripheral organs like kidneys, diaphragm, skeletal muscles and liver. है ना? इसकी वजह से क्या हो रहा है? End organ damage. So end organ damage starting शुरू हो गया है ना? From here only it started. Now if the hypoxia is continuing, if there is prolonged hypoxia, then what will happen is that there is compromised myocardial function. Okay, that would lead to myocardial ischemia. Myocardial ischemia मतलब myocardial contractility कम होगा. When myocardium is not contracting, cardiac output भी कम होगा, right? When cardiac output is less, obviously the worsening of ischemia in the peripheral organs will be more. So all of you understood the pathophysiology of multi-organ damage perfectly, yeah? बताओ जल्दी. Very good. Very good. Very good. Very good. So let me write a message for all of you. You are all yeah. Chalo. Now let us discuss the pathophysiology of brain damage. Guys, pathophysiology of brain damage mein there are some stages, okay? So these stages are important, okay? So what are the stages here? First of all, मैं ये करूंगा कि first of all I'll write down the stages, है ना? उसके बाद I'll explain you the concept. The first important stage is primary energy failure. Primary energy failure, ठीक है? Second important stage क्या है? इसके बाद latency period. Latency period, okay? Third important stage क्या है? This is called as secondary energy failure. Secondary energy failure. And final, the last stage is called as brain damage. The last stage is called as brain damage, okay? So what are the stages? 4 stages are there here. What are these 4 stages? Primary energy failure, latency period, secondary energy failure and brain damage, okay? So we shall discuss one by one very fastly, okay? Now all of you look here. Let us say that this is your brain, okay? This is your brain. Now you know that this is a blood vessel that is supplying the brain, है ना? ये देखो, this is your peripheral let us say capillaries, na? And these are the venules which are collecting and finally draining into the vein. Now arteries are bringing oxygen. Okay? Now this oxygen will be supplied to the brain. Yeah, normally it happens in you and me. Okay? But in this patient, what is happening right now? There is decreased oxygen supply. So obviously less amount of oxygen will be supplied to the brain. Whenever an oxygen is coming, in exchange of oxygen, carbon dioxide should come. So यहाँ पे how much amount of carbon dioxide will leave? Obviously less amount of carbon dioxide is gonna leave here. Less amount of carbon dioxide is gonna leave. So overall what is the result? Brain के अंदर अभी oxygen का status क्या है? Low. What is the level of carbon dioxide? More. Right? Now, if there is increased level of carbon dioxide in the brain, what is gonna happen? This increased level of carbon dioxide is gonna combine with water. एक बार combine हुआ, this will result in the formation of H2CO3. And you know, H2CO3 is a highly unstable molecule. It will dissociate into two components. क्या है? One is called as H plus, another one is called as bicarbonate. Right? Now, what is H plus? H plus is an alkali or acid? Acid. So, because of excess carbon dioxide levels in the brain, what is happening? There is brain acidosis. Very important thing. Brain acidosis. What is happening? There is brain acidosis. So, the first point all of you have to write is, there is brain acidosis. Brain acidosis. ठीक है? Brain acidosis के बाद क्या होगा? Now, you tell me that, let us say there is a cell here in the brain, a neuronal cell. ठीक है? A neuronal cell in the brain. Now, neuronal cell के अंदर mitochondria होगा, right? If mitochondria has to release ATP, first of all, you should supply oxygen to mitochondria. But right now in this patient, we are supplying less amount of oxygen to mitochondria, less amount of oxygen to the cells. So, do you think there is sufficient ATP released? अगर ATP release नहीं हुआ, do you think the pumps will work? Sodium, potassium, right? Calcium pumps and all these pumps, do they work? They don't work. If pumps are not working, do you think the metabolites which are released within the cell, are they cleared off or they are getting accumulated? Obviously, the metabolites are getting accumulated within the cell. They are not cleared off. So what are all these? All these are the metabolites. Metabolites. तो ये मेटाबोलाइट्स जब accumulate होगा, what is going to happen? What is going to happen is that surrounding the cell, whatever water is, metabolites are something like solutes. Okay, outside you have got solvent. So what is going to happen? What is going to happen is that water from outside will enter into the cell. Water from outside is going to enter into the cell. So when water from outside enters into the cell, don't you think the cell will swell up? Yes. So because of brain acidosis, there is cellular swelling. Cellular swelling होने की वजह से क्या होगा? Finally, the cell will undergo apoptosis, right? So there is finally apoptosis. So till here, whatever explanation I have given you regarding the brain, this is called as primary energy failure. This is called as primary energy failure. All of you understood what is primary energy failure? This is called as primary energy failure. Okay? So this concept which I have explained you till now, इसको बोलते हैं primary energy failure. So primary energy failure के बाद कौन सा है? What is the next concept? Latency period. What is this latency period? Latency period मतलब primary energy failure होने के बाद, okay, after primary energy failure, for few hours, right? For few hours, there is a time, there is a period called latency period. This latency period में, if you are trying to provide very good amount of oxygen to the brain cells, some of the brain cells can recover and they can live normally. Okay, that period you call it as latency period. Clear? That period you call it as latency period. Latency period के बाद कौन सा period है? Secondary energy failure. What is this secondary energy failure? Now all of you look here. What is happening? So right now the brain injury has happened, है ना? So from now to the next 6 to 48 hours, ठीक है? अभी brain injury हुआ because of low oxygen, primary energy failure हुआ. From now till the next 6 to 48 hours, what will happen is that there is excess neurotransmitter release. or I have to use a proper term, there is excess neurotransmitter in the brain. Okay, what neurotransmitters you are talking about? I'm talking about two neurotransmitters. One is dopamine, another one is glutamate. Dopamine as well as glutamate, both of these neurotransmitters are right now in the brain. Now you might get a doubt, why after 6 to 48 hours? The reason is that after 6 to 48 hours what will happen is, ye dekho, these are the neurons, है ना? So these neurons for about 6 to 48 hours they are under severe stress. So उसके बाद क्या होगा? The neurons will be damaged. When the neurons will be damaged, neurons के अंदर vesicles होगा, the vesicles are blasted out. When the vesicles are cut open, don't you think vesicle के अंदर neurotransmitter होगा? So this neurotransmitter within the vesicle is released outside. Yes or no? So many neurons are dying, many vesicles are bursting out, so lots and lots of neurotransmitter is released. Not only that, whatever neurotransmitter is released, time to time you have to clear it off. Yes or no? You have to clear it off. अगर cells ही नहीं है यहाँ पे, the function is only gone here, everything is gone. How do you think the neurotransmitter which is already present, it is cleared off? It cannot be cleared off. So two things are making excessive neurotransmitter in the brain. One is damage to neurons leading to excess neurotransmitter. Second is reduced neurotransmitter clearance. In दो कारण की वजह से, because of these two reasons, there is excess neurotransmitter in the brain. So what will happen if dopamine is there? Dopamine is an inhibitory neurotransmitter. It will inhibit your central nervous system. What is glutamate doing? Glutamate is an excitatory neurotransmitter. It will overexcite your brain. So both of them will result in what? Both of them will result in seizures. Both of them will result in seizures. So after 6 to 48 hours, the patient will have seizures. क्यों? क्योंकि brain में abnormal electrical activity चल रहा है because of the neurotransmitters. So I hope you understood till here. है ना? अभी ये मैंने जो डिस्कशन बताया था ना, this is what is called as secondary energy failure. This part is called as secondary energy failure. So after secondary energy failure, the last important thing you have is brain damage. Okay, brain damage. So after secondary energy failure, what is going to happen? What is going to happen is that in the long run matlab, for example, today the primary energy failure has happened. So from today, let us say after 5 months or 6 months or at least 1 year, है ना? So in the long run, what is going to happen is that the brain damage is so severe that new neurons are not developing. New neurons are not developing, matlab, what should I write here? Impaired neurogenesis. Impaired neurogenesis. Okay. Second important thing क्या होगा? If neurons are not developing, obviously the axons are also not growing. There is no axonal growth. There is no axonal growth. Not only axonal growth, whatever neurons are there in the brain, or by chance, okay, by chance there is a new neuron, है ना? What the new neuron should do? It should adapt to the external brain environment, है ना? अभी surrounding पूरा इतना severe damage हुआ कि the neurons are not even adapting to the external environment. This is called as reduced neuroplasticity. This is called as reduced neuroplasticity. Okay. So after all these three things which are happening in secondary energy failure, finally it would lead to a condition called as brain death. Brain death. So this is all the discussion about the pathophysiology of brain death, pathophysiology of brain damage. All of you understood these two pathophysiologies, guys. One is pathophysiology of organ damage and another one is pathophysiology of brain damage. You understood this, everyone? If you understood, then I'll go for signs and symptoms and we'll be done with the classes. Okay. So all of you understood this? Everyone? Sadiq Khan, you understood? Jasmine, fun zone and fun mode, both of them understood? Miracles world. All of you understood, right? And what about Chinenye? Mohammad Asif, Shraddha, medicine recap, vanilla, all of you understood? Everyone understood, right? Very good. Very, 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 very good. Lost soul. Hi, lost soul. Very good. Chalo. Right now, what we do is we shall discuss about the signs and symptoms. We shall discuss about signs and symptoms. Okay? So signs and symptoms क्या होगा? Depending upon the degree of hypoxia, the signs and symptoms can vary. Right? If hypoxia is for a less time, the signs and symptoms different hoga. If it is prolonging, the signs and symptoms different hoga. Okay? So first what we shall do is that, for example, if there is reduced oxygen supply to the body, reduced oxygen supply to the body is called as asphyxia, है ना? इसको बोलते हैं asphyxia. So इसकी वजह से क्या होगा? Initially, now all of you tell me guys, initially what are the things that can happen if you don't provide oxygen to the baby? There will be blue discoloration of the body. Yes or no? You call this as cyanosis. Yes or no? You call this as cyanosis. Skin or mucous membranes, they turn to blue in color. है ना? So initially क्या होगा? The skin and mucous membranes, they turn to blue color. They turn to blue color. Okay. So what do you call this condition as? This condition is called as cyanosis. This condition you called as cyanosis. Now this is the first thing that is happening. Okay. Abhi second thing क्या होगा? What is the second thing that is happening is that because of this cyanosis, heart rate जो है, the heart rate is also reduced. Now very severe reduction in heart rate? No, mild. There is mild reduction of heart rate. अगर हार्ट रेट कम हो गया, इट मींस हार्ट इज नॉट पंपिंग प्रॉपरली. व्हेन हार्ट इज नॉट पंपिंग प्रॉपरली क्या होगा? कार्डियक आउटपुट भी कम होगा, राइट? सो अलोंग विद दैट द कार्डियक आउटपुट इज आल्सो रिड्यूस्ड. देन द अमाउंट ऑफ ब्लड रीचिंग आउट ऑफ योर हार्ट इज लेस. इसका मतलब क्या है? ब्लड प्रेशर भी गिरेगा, लो ब्लड प्रेशर. बट ऑल दिस थ्री थिंग्स आर हैपनिंग माइल्डली, नॉट सिवियरली. ठीक है, माइल्डली. नाउ थर्ड इंपॉर्टेंट थिंग क्या होगा? आई टोल्ड यू इन द स्टार्टिंग ओनली, whenever there is reduced oxygen supply to your body, there is a backup mechanism, sympathetic system activate hoga or peripheral vasoconstriction hoga, right? So here also, if there is initial hypoxia, this would lead to peripheral vasoconstriction. Vasoconstriction, okay? Peripheral vasoconstriction. So cyanosis, mildly reduction of heart rate, cardiac output, blood pressure, or peripheral vasoconstriction. Now these three things whatever I have told you, this is called as primary apnea. Primary apnea. If someone is asked you primary apnea, what is the color of the baby? Blue. Obviously blue, है ना? Primary apnea बहुत serious condition है? No, everything is mild here. Okay. For example, primary apnea can convert into secondary apnea. When, if the oxygen, if there is low oxygen, right? If this hypoxia is continuing still for a long time, if hypoxia continues, this would lead to a condition called secondary apnea, है ना? So in secondary apnea क्या होगा? What will happen in secondary apnea? Initially the baby color is blue, है ना? Initially the baby color was blue. Now in secondary apnea, blue will change to white. White मतलब pale हो जाएगा baby, okay? The baby will be pale and blanched. So when you see a pale and blanched baby, this is a cause of secondary apnea. So secondary apnea में symptoms क्या होगा? What will be the symptoms? The first important thing. If the baby is blue, you call it as blue asphyxia. If the baby is white, you call it as white asphyxia. Second important thing, यहाँ पे भी heart rate reduction होगा, but यहाँ पे heart rate reduction is more severe or less severe? It is more severe. So there is more severe reduction of heart rate. Not only heart rate, even blood pressure also falls down drastically. Okay, blood pressure also falls down drastically. And not only that, two more important features क्या है? The muscle tone, whenever I tell muscle tone, you should always tell reflexes. ठीक है, दोनों muscle tone और reflexes भी they will fall. So whatever symptoms I have discussed just now, all these come under secondary apnea. So overall ये signs and symptoms जो है we can classify into two types, है ना? Less oxygen supply for a short period of time, primary apnea. अगर वो less oxygen is prolonged for a long period of time, hypoxia for a long time, secondary apnea. Primary apnea, blue asphyxia. Secondary apnea, white asphyxia. Primary apnea में heart rate, cardiac output और blood pressure mildly reduced. यहाँ पे बहुत severely reduced. All of you understood the two differences here? Yeah? Very good, very good, very good. Very, 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 very good. चलो. Now, all of you look at this picture, guys. ये देखो यहाँ पे. So one is called, you can see a bluish discoloration over here. ये देखो bluish discoloration around the mouth. है कि नहीं? Right? ये देखो bluish discoloration है. So this is called as cyanosis. And ये वाला picture जो है, this is called as pale. You see the baby is pale completely. है ना? This is called as white asphyxia. Clear? White asphyxia. So actually, I don't know, here the baby seems normal only, right? For just to differentiate, I have just kept a picture of a white baby telling it is white asphyxia, right? But actually in white asphyxia, baby won't be white, baby will be pale, okay? I hope you know what is pale. So baby will be pale. So just for an example, I kept it. It doesn't mean that this is a pale baby, okay? For an example, I kept it. Very good. Fun mode is telling, हाँ, ये primary apnea है. Primary apnea which is converted into secondary apnea. Okay? So as this topic is very big, actually there was one classification, guys, that is called as Sarnath classification. Sarnath and Sarnath staging करके एक staging method है that was discovered in back in 1976. Okay? So based upon that staging method, I won't discuss that staging method right now. I am leaving it for you itself. So just remember this table. There is nothing to explain also here. So I have simplified this table over here. All of you look here. ये देखो. This is the table. कुछ difficult नहीं है. Very easy. So what are the features which you see is Lankas. ठीक है? LANCAS. Lankas मतलब क्या है? L stands for level of consciousness, A stands for activity, N stands for neuromuscular control, C stands for complex reflex, A stands for autonomic, S stands for seizures. ठीक है? ये इसको बोलते हैं Lankas. ये Lankas में ना माइल्ड, मॉडरेट, सीवियर तीन चीजें हैं. ओके? लेवल ऑफ कॉन्शियसनेस. माइल्ड हाइपोक्सिया है तो उसका लेवल ऑफ कॉन्शियसनेस नॉर्मल रहेगा. ओके? मॉडरेट हाइपोक्सिया है तो लेवल ऑफ कॉन्शियसनेस इज लेथार्जिक. सीवियर हाइपोक्सिया ही कैन गो इनटू कोमा. You know why? Brain acidosis and all. Activity, less oxygen, mild hypoxia, normally ही रहेगा. उसके बाद decrease activity, उसके बाद absent activity. So the same way, everything is there. Neuromuscular control क्या होगा? Posture, stretch reflex, right? These are some things you just need to study. There is no need to explain. These words are very lame words. You can very easily understand here. Okay? So all of you are done. Shall we move forward? And by the way, one important thing I'm going to tell you here is that यहाँ पे, if you see in this patient, regarding the posture, when you look at the posture, in severe hypoxia, the posture is intermittent decerebration. ठीक है? Intermittent decerebration मतलब legs, the both hands and legs, both of them, they turn like this. Okay? Suddenly they turn like this. And suddenly they'll become normal. And again, suddenly they'll turn back. Okay? Again, they'll become normal. So they are flexed like this. They are flexed and again, they become normal. So let me show you the picture also. You'll understand it. Ye dekho. All of you look here. Arms extended with wrists rotated. Legs extended with feet internally rotated. Okay? So this is called as intermittent decerebration. Clear? Intermittent decerebration. Look at the real life scenario. Ye dekho. Look at the baby. Look at the hands of the baby. They are folded inward. है ना? Completely extended and folded inward like this. ये देखो. Okay, so this is what is called as decerebration, right? Now we are till the end of the topic, guys. The end of the part we will discuss how do you diagnose. Shall take it. You got a case, है ना? Umbilical cord prolapse हुआ, नहीं तो shoulder dystocia हुआ, नहीं तो cord, nuchal cord, I mean compression around the neck, whatever it is. You got a case. Now what will you do? You got a case of what? You got a case of neonatal encephalopathy. You got a case of neonatal encephalopathy. Now, whatever features I'm giving, right, out of all these features, if there is at least one or more feature, you give a diagnosis of neonatal encephalopathy. So, neonatal encephalopathy confirm ho gaya. One or more feature rahega to. What are those features? I'll write it now. For that, just remember a small mnemonic. If you want to say that, for example, when you meet a film actor, a cricketer or whatever it is, you tell that I am a big fan of yours, है ना? So how do you write it in Hindi? आप, मैं आपका fan हूँ, है ना? मैं आपका fan हूँ. आप fan हूँ. आप मतलब आपका fan हूँ. Okay? आपका, आपकी, whatever it is. I'm not good at Hindi. चलो, जो भी है, you understood, right? AP, what does AP stand for? AP stands for Apgar score. All of you know what is Apgar score. You know, once after the delivery, Apgar score we check at 1 minute as well as 5 minute, है ना? But यहाँ पे readings जो है ना, we take an Apgar score reading at 5 minute, and 10 minute reading. So 5 minute or 10 minute reading लूँगा मैं, right? After taking 5 and 10 minute reading, if normally the Apgar score should be around 7 to 10. You have to get a point of about 7 to 10. If it is less than 5, right, then you can consider that this is neonatal encephalopathy. Not only Apgar score, there are another important things. F stands for fetal umbilical artery. Fetal umbilical artery. Now, in this fetal umbilical artery, what do you need to know? You have to check the pH. So, once the baby has been delivered, right? Once the infant has been delivered, you clamp the umbilical cord and you cut the umbilical cord. Now, when you cut the umbilical cord, from the umbilical cord, you can even take a blood sample and send it to the labs. Okay, so that is what is called as fecal umbilical artery. So lab में ना हमको पता लगेगा इसका pH कितना है, right? So there we can get to know the pH. If the pH is less than 7, normally कितना होना चाहिए? Normally the pH should be 7.1. Okay, if the pH is less than 7, then acidic only. Why acidic? Because of low oxygen, right? Third important thing. And by the way, these values, whatever I'm taking it from NIH, National Institutes of Health. That is a standard website, guys. Next important thing is arterial base deficit. Arterial base deficit matlab, let me write down. If it is more than 12 millimole per liter, what is arterial base deficit? Is agar arterial base deficit 2 से ज़्यादा है, if it is more than 2, then the person is said to be having metabolic acidosis. So don't you think wherever there is less amount of oxygen, there will be metabolic acidosis only, right? So more than 12 मतलब पक्का metabolic acidosis होगा. Yes or no? Right. Now, after this, I do a neuroimaging. मतलब I will take an MRI. MRI में मुझे दिखना चाहिए कि हाँ यहाँ पे ब्रेन इंजुरी है. ये देखो, ये MRI लिया. You can see a hyper intense lesion here. ये देखो on both the sides. है कि नहीं? मतलब यहाँ पे इंजुरी हुआ, brain injury. Why? Because of less oxygen supply to this part of the brain. Okay? Yes, there is an evidence of acute brain injury. Okay? So all of you look here now. And the last point is multi-system organ failure. Multi-system organ failure should be there. Okay? So what is the mnemonic here? AP stands for Apgar score. Fan, 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 who, right? Who or mu, whatever it is. And F stands for fecal umbilical artery less than 7, arterial more than 12. Neuroimaging should confirm acute brain injury. So out of all these, if you see one or more features, then it is confirmed that the baby is under neonatal encephalopathy, right? So this is something, this is not conceptual anyways, this is something you just have to remember, है ना? इसको by heart करो, कुछ भी कर लो, but you have to know this thing, ठीक है? So after this, the next important thing we shall discuss is the last part of today's topic, that is the treatment. See, from the start of the topic till here, I discussed all the mechanisms, everything. So overall, you got an idea that this problem is really very big problem and a very dangerous problem. Now, what I do is, the only one thing I do is, the only one simple treatment I do is cool the brain of the baby. That is the only treatment I can give. That is called as therapeutic hypothermia. Now, it seems funny, but this is effective. Therapeutic hypothermia. Okay. What I do is, I do a thing called as therapeutic hypothermia. Abhi ye therapeutic very good. Fun mode is telling cooling therapy. You know what is therapeutic hypothermia? Simple thing. I will cool the brain of the baby. How will I cool? Will I put the baby in the refrigerator? No, I don't do those things. Okay. What do I do is that I simply cool the brain of the baby. First of all, I'll tell you why do I do this, and later on I will tell you how I am going to do it. Why do I do this is that, first, neuroprotection. It will protect the brain. Second thing, brain is demanding a lot of oxygen right now. You're not providing that oxygen. That is why there is a lot of damage, primary energy failure, secondary energy, ये सब क्यों हो रहा है? Because when you're not supplying enough amount of oxygen. So I have to stop the brain telling you better decrease your metabolic demand, है ना? Oxygen कम पूछा करो. So to decrease that metabolic demand, what I do is that I do therapeutic hypothermia. So two important things over here. One is neuroprotection. And second one is, it will decrease the metabolic demand. It will decrease the metabolic demand. Okay? Now, so how do I do it? There are two ways to do it. What are these two ways? Is, one is, I will put a cap and cool the baby's head. Put a cap matlab Gucci, Calvin Klein, है ना? ये वाला caps नहीं. Cap matlab there is separate coolant cap. Okay, you put that cap and reduce the temperature. एक ये है method, और दूसरा method है full body you will reduce the temperature. This is called as systemic hypothermia. So one is called you will only cool the head, that is called selective head cooling. Okay. Second important thing is systemic hypothermia. Okay. So how do you do selective cooling? You will do selective cooling by using a cap. So let me show you if I have a picture of that. Right. I actually don't have a picture, but I'll try putting that picture for you. Right. All of you look at this picture. You see there is a cap that is kept. So this is a cooling cap. Okay. So this is how you put the cap. Okay. This is what is called as selective cooling. और systemic hypothermia क्या होगा? Systemic hypothermia मतलब you will wrap the baby with cooling blankets. Okay, cooling blankets. You will wrap the baby with the cooling blankets, or you will make the baby to sleep on a cooling mattress. Okay, wrap the baby matlab you don't put the baby in the center and wrap it completely as you wrap your Amazon packs. Okay, so wrapping matlab the wrapping should be only till the lower level of the shoulder, or too tight packing mat karna, है ना? You have to wrap it mildly. Okay, 1 or 2 turns. Okay. So sir, when should I do this? Baby is born with neonatal encephalopathy. I diagnosed the baby with neonatal encephalopathy. Okay. When should I start doing this cooling therapy? Once the baby is born, within 6 hours you should start this cooling therapy. Okay. So you should start this cooling therapy in less than or equal to 6 hours. Till how much time should I cool the baby? Till 72 hours. Till 72 hours. So 6 hours of life till 72 hours. So you are telling about cooling therapy, but tell me what is the temperature you use there? The temperature which I use here is 33 to 35 degrees Celsius. Okay? 33 to 35 degrees Celsius. All of you understood, guys? All of you understood whatever I've told you till here? This is what is called as cooling therapy. Okay, this is what is called as cooling therapy. Now the last part of today's lecture we shall be discussing how do you look at a MRI, है ना? अगर neonatal encephalopathy हुआ, you too can MRI. So on the MRI, what will you find? That is the last thing we shall discuss for today. Okay? So that is what is called as your imaging studies. Imaging studies. Okay? So in the imaging studies, you need to know that the most sensitive test you do is cranial MRI. Cranial MRI. This you do for HIE. Okay, and guys remember one thing, ये therapeutic hypothermia जो है ना, this is the right now updated protocol में भी सिर्फ यही treatment है for mild to severe, right? For moderate to severe cases of hypoxic ischemic encephalopathy, the only treatment which you give right now, the only management is therapeutic hypothermia. ठीक है? Right, चलो. Now how does an MRI scan look? MRI में you will see three things. There are three different types of neonatal encephalopathy findings which you will see on an MRI. What are these three variants? Three types क्या होगा? एक होगा, you know, in the brain we have got gray matter. You will see a damage in the gray matter. Okay, that is called as deep nuclear gray matter injury. Okay, this is one finding you see. I will explain you about each finding. Okay, दूसरा finding. What is the second finding you see? Second finding you see is watershed cortical injury. Watershed cortical injury. I will explain you what is watershed and what is cortical injury. और तीसरा finding जो है ना, this is called as parasagittal. Just listen to whatever I'm telling now. I know you're not understanding this. Parasagittal injury of cerebral cortex. Parasagittal injury of your cerebral cortex. First we shall discuss watershed cortical injury. Okay? First of all, what is this watershed cortical injury? All of you look. This is the surface of your brain. Okay? Now here what I'm doing is that, ये देखो, this part which I'm shading with yellow, है ना? ये entire region जो है ना, this is supplied by anterior cerebral artery. Anterior cerebral artery जो है ना, ये area को supply करेगा. Okay? After this, look here, this entire region, whatever I'm highlighting right now, ये देखो, with the green, okay? With the green, this region, whatever I'm highlighting right now, this region entirely supplied by middle cerebral artery. And all of you know यहाँ पे बीच में क्या होगा? Ventricles. These are your ventricles, है ना? So this entire area is supplied by middle cerebral artery. Or the last one, the last important thing is this entire area with the blue which I'm drawing right now, this entire area is supplied by posterior cerebral artery. So यहाँ पे क्या है? Anterior cerebral artery है, यहाँ पे middle cerebral artery है और यहाँ पे posterior cerebral artery है. Fine. Now the place where anterior cerebral artery and middle cerebral artery they are joining each other, ये देखो यहाँ पे, okay? The place where they are joining each other, right? This area is called as watershed area. In the same way, middle cerebral artery is joining with the posterior cerebral artery. So this area is also called as watershed area. Okay? So branches from middle will come, branches from posterior cerebral artery will come. ये दोनों fingers के बीच में ये जो area है ना, this is called as watershed area. So if either this artery or this artery is infarcted, क्या होगा? If this artery or this artery is occluded or obstructed, क्या होगा? This region will be infarcted. This region will be infarcted. Clear? So overall in a bird view, if I look, don't you see, I can find a shape of an S like this. You see, this is one watershed area. उसके बाद यहाँ पे ventricle आ गया. उसके बाद this is another watershed area. So if this area, in this area, if there is any infarction, I can see a white color patch here like this. I can see a white color patch down also like this on both the sides. Yes or no? That patch you call it as watershed cortical injury. Now I'll show it to you. All of you look here. ये देखो. All of you can see here. Can you see a very dense lesion on the top here? And you can also see a very dense lesion on the bottom. ये देखो यहाँ पे भी on the top, on the bottom. So this is what is called as watershed cortical injury. All of you understood this or no? Let me know, all of you understood this or no? Yeah? Pushpalata, Anmod, Suraj, Funzone with Kittu, Jasmine, all of you understood? Sajda, very good. Okay, first year students understood. If you understood, then the remaining all of you understood. No problem in that. First years understood. First year students who are watching this understood. Very good. Very good. So this is what is called as watershed injury. This is what is called as watershed cortical injury. Okay, watershed cortical injury. Okay. Now, if you want much more easy explanation, यहाँ पे आराम से देख सकते हो. This arteries you see, ये anterior cerebral artery का है और ये posterior cerebral artery का है ना? ये देखो, anterior और posterior, both of them are supplying this region. ये देखो, this region which I'm highlighting now, this region is called watershed area. Clear? Fine. You are clear with watershed. अभी ये क्या है? What is parasagittal? Sagittal मतलब ये जो बीच में है, that is sagittal. Para means on either sides. It means on either side of the midline, if you are seeing some high intensity lesions, that is called as parasagittal injury of the cerebral cortex. ये देखो एक बार, ये देखो. All of you look here. You see, this is the center here. On either sides, you can see white color lesions here. Yes or no? See here also, this is a center. On either side, you can see white color lesions. This is parasagittal. और यहाँ पे देखो, from the top here till the bottom, you have got this. This is called what? Watershed injury. एक होगा parasagittal और दूसरा होगा watershed injury. All of you understood, guys? अभी तक जो भी मैंने discuss किया, you all understood, right? है ना? So this is what I was telling you. मोस्ट सेंसिटिव इज क्रेनियल एमआरआई स्कैन लेना पड़ेगा. अगर हॉस्पिटल में एमआरआई स्कैन नहीं है, इन सम गवर्नमेंट हॉस्पिटल्स देयर आर नो एमआरआई स्कैन्स. ओके, द हॉस्पिटल व्हिच आई वर्क, there is an MRI scan. That is a very famous government hospital. I cannot take its name. There is an MRI scan, but it is under repair from the past 8 to 9 years. है ना? So you can think of that. अभी तक MRI ठीक नहीं हुआ, है ना? So obviously what we do is that if MRI scan is not there, the second step you do is you do a CNS ultrasound. Okay. Next, echocardiography. Yes, I do echocardiography क्योंकि यहाँ पे heart is also not functioning. So I will do an ECG and see कौन सा लीड में ST elevation है, कौन सा लीड में ST depression है. Okay, myocardial injury के लिए. So when do I do EEG? EEG is electroencephalogram, है ना? So why do I do EEG? I told you there is dopamine release, है ना? I also told you there is glutamate release, excess amount of release of these neurotransmitters. Hi Deepu, excess amount of release of these neurotransmitters would lead to abnormal electrical activity which is called as seizures. So seizures को देखने के लिए, is there any seizure activity or not? I will do EEG. Okay, and obviously biomarkers like vascular endothelial growth factor I will see to see whether there is any vasculogenesis or no. Okay, so this is all the important things which you need to know regarding the topic क्या है वैसे, hypoxic ischemic encephalopathy and perinatal asphyxia. All of you understood, guys? All of you completely understood? Yeah. So was it completely clinical? Right, because all of you, है ना, नाम के वास्ते you have to not read. Okay, you have to read everything clinically. So I hope that I have integrated all the clinical part whatever I could. So all of you understood. Fun mode you understood. Sajda, very good. Pushpalata, you understood, right? Deepu, Mamata Deepu, you understood. Suraj, you understood. Fun zone. Jasmine is there here. Very good. All of you, was this lecture worthy for all of you guys? Very, very, very good. Very good, guys. So Hope you have all written the notes also. So if you haven't written the notes, I'll send you the notes now itself, है ना, in the group. So you can watch the video in your leisure time, and after that you can make the notes, है ना. So instead of looking at the notes and making the notes, you watch the video and make the notes. That would be easy for you, है ना. So yes, more topics I'll discuss. Don't worry about that. है ना. Step by step we shall be discussing all the topics. So always remember, something is better than nothing, है ना. So next session we haven't planned yet. Next session will be mostly tomorrow or day after tomorrow, but we will mention it, okay. So जब भी next session होगा, one day before we will immediately tell you, update you, okay. We'll update you in the Telegram group, we'll update you on the channel as well, okay. So all of you, thank you so much. Deepu, Mamta, thank you so much. Thank you so much, all of you. Take care and goodbye and love you all.